Greetings, I'm Clayton Smith, and I'm going to be talking about why it's been such a challenge to provide greater access to care that's more cost effective and also meets the high quality standards in the United States. So with that point, there's three major questions that are asked. The first question is, what efforts have been put into place to improve the access to care? There's four efforts I'm going to be talking about. The first effort is changing the scope of the practice laws. The main responsibility should always stay with a primary care physician, but due to the increase of patients, this can require registered nurses, nurse practitioners, and physician assistants to all increase their role in the doctor's office to lessen the burden of the primary care physician. Also, outside the box solutions to optimize care. With that being said, this includes medical visits with 15 to 20 patients at a time, so a doctor can save time and see patients that all have the same medical issue going on. And this is also a benefit to the patient because they can discuss ideas or issues that's been going on with them to other patients and see if the same thing has been happening, and they can discuss medications that are used. So for example, Bob's medicine might be more expensive than Sally's, and Sally's is more effective. So Bob might want to switch his medicine to Sally's medicine. But a downfall to that is that you don't get that one-on-one time with your doctor that you would normally get. Also, improving access to care is by reaching out to the people in the rural areas by telehealth, which is visiting your doctor over the phone, on the internet, or even video chatting with your doctor. So this can turn a routine checkup for somebody that's, let's say, lives an hour away from their doctor's office into a quick 15-minute Skype call. And the fourth point is extending physician hours. Not everyone is able to visit the doctor that has traditional hours like 8 to 5 because of their own job. So with that being said, physicians can partner with retail clinics such as CVS or Walmart for after hours care. This can lessen the visits to the emergency room for patients because they're now able to visit a representative of their doctor at CVS or Walmart. A downfall to that is that you're not actually visiting your doctor, it's just a representative of your doctor. So the second question is, what factors have made it difficult to achieve reliable quality of care? And I believe location and social status play a huge role in this. Location because, for example, if you're in the inner city, you're not going to receive the same quality of care as opposed to somebody in the suburbs would, due to the average income difference between the inner city and the suburbs. And also social status because I believe the more money that a person makes, the higher quality of care that they'll receive. For example, Magic Johnson. If you do not know who Magic Johnson is, Magic Johnson was an NBA player who contracted HIV/AIDS, and because Magic Johnson has money, he's able to provide for himself the doctor visits, the medication that he needs to stay healthy, as opposed to the average citizen who cannot. And the third question is, how have various individuals or groups sought to achieve or sought to contain healthcare costs? And with that being said, doctors, physicians, and community members have all done health education or wellness programs to educate the community on how to be more aware of their health and just how to stay healthy in general, to see what they learn in the classroom and they can put that to use in the real world, which can save their healthcare costs because they're not visiting the doctor as much because they're more aware. So in conclusion, I've answered the three major questions as to why it's been a challenge to provide greater access to care that's cost effective and also meets the high quality standards in the United States. Thank you.